Welcome to this afternoon's webinar, Navigating AI and the New Revenue Cycle Landscape. So with that, I will introduce our speaker for today. This is Jason Petrosic. He is the Senior Vice President of Artificial Intelligence at Meduit. Jason drives revenue cycle solutions powered by AI that support healthcare's providers' operational, clinical, and financial health. He brings over 25 years of RCM experience in revenue cycle process design, efficiency, and resource optimization. Prior to joining Meduit, he served as National Vice President of Revenue Cycle for Prospect Medical Holdings, Inc., Vice President of Operations for Navigant Symmetrics, and Senior Director of Operations Planning for Conifer Health Solutions. He earned his Master of Business Administration from Pepperdine University. So Jason, I will let you take it away. Thank you for your time today.
Awesome. Thanks, Becca. And I appreciate everybody joining with me on your lunch hour. Hopefully y'all got some food to eat while we talk through AI a little bit. This is an area of topic within RevCycle that's kind of I'm passionate about. Becca mentioned kind of my history. I'm a longtime RevCycle guy. I've run operations. I know the challenges that people have with staffing and work queues and bottlenecks and technology challenges and all that kind of stuff. So it's always been my hobby to go through and look for the opportunities to help make that better. And so I'm going to share some of that with you today a little bit and talk about kind of some of what I'm seeing in the industry, some of what we're doing here at Meduit, and other vendors are doing as well. Just a quick overview of Meduit. I promise I won't spend long here. Just wanted to let everybody know that we are one of the largest independent RevCycle providers in the country. So we have operations in 10 states, including our newest state of New York that we just added this month, with a lot of a footprint. So 800 hospitals, tens of thousands of physicians, well over 1,000 employees. So we've got a deep background in RevCycle. And we do end-to-end solutions for pretty much anything that you're looking for in RevCycle. So let's jump in and talk about where we are. So obviously, the dust is starting to settle on COVID, right? Things are coming back to normal. Hospitalization rates are finally starting to decline, which is excellent news. I know we still have to be, safe and wear masks and, social distance and all that kind of stuff. But, I really think, and I've seen this over the last 4 or 5 weeks or so, RevCycle leaders are really starting to kind of look at, okay, what am I going to do for 2021? How am I going to make this different? We've survived the business trauma, sometimes personal trauma of COVID. And what do we need to do different? So, I think RevCycle leaders have all known this for a long time, right? That our business is not very efficient. We rely on a ton of people to push claims around, to push accounts through systems, to fix things, to log into work queues, to do all this kind of stuff. And I think people realize that there's got to be better ways to do this, and there are. And I think that COVID kind of gives us that impetus to start to make those changes in the industry. And I have a quote from a CEO of a health system in the Midwest who says, "None of us would have chosen to be in this COVID-19 storm and experiencing this level of disruption, but we must adapt. We're making very difficult decisions that will reshape our organization going forward." And so, what is that? What are those things that are changing? Remote work, obviously, is kind of the key topic here. A lot of organizations have had sent people home, work from home, just adapted as best as possible, but even not necessarily having the best tools to manage those people. So that's something that we want to look at, right? So from an industry, I think there will be more remote RevCycle workers going forward. What does that mean for HIPAA? What does that mean for data security? do you have to have, webcams in people's houses so you can kind of see their business space to meet your compliance requirements? There's a lot of things that the organizations are tackling right now to figure out how to be in a better position for handling remote workers going forward in a more stable environment. The other option, again, that's been on the table for decades is outsourcing, right? So looking again at areas of your operation that maybe were impacted by, losing the ability to have staff, or losing productivity by having staff at home, and those negatively affected your cash flow or your AR days, whatever it is that the issue is. Maybe taking another look at that and saying, we didn't used to outsource this, but maybe we have some overflow set up or some, relief valves so that we can, insulate ourselves from those impacts. One of the things that I want to talk about, as we go through here is helping you as business leaders really kind of pull back the layers of the onion. Like, AI is you're going to hear that from companies as marketing and branding, right? So market, oh, it's an AI solution. Well, what is it really? And so we're going to talk a little bit about what are the pieces and components that are valuable, right? So just because somebody markets it as AI, doesn't necessarily mean that they're bad, right? So I want you to understand what are those pieces and what you should look out for as you talk to potential vendors to help you with this. So, I have some examples. We'll go through some real world examples of how AI technologies are driving this forward today. So not talking about, vaporware and futuristic type stuff. These are things that you can actually do today. So if you wrap up your lunch with me, then you can go off and check out some vendors and look at this. So, what is AI? So I mentioned it's kind of a marketing buzz. The last, in-person conferences that a lot of us attended were in 2019, Becker's or ANI, right? So if you were lucky enough to have made one of those trips, I'm sure you saw AI all over the exhibit hall and in the vendor presentations. And I think that push is going to continue. You're going to see a lot of emails and vendors that are pushing that. So what really is it? So artificial intelligence, I think, breaks down into really kind of 4 kind of categories of technology. So we'll talk about each of these. So the first one is regression analytics, and this has been around for decades. This is something like propensity to pay scoring, right? So you've had this, or your vendors who are doing your patient collections have had this for a long time. And really what that is just looking at past data and behavior and using that data to predict what might happen going forward. And it's just a recommendation. So, the best analogy is your credit score, right? So if you check your credit score, whatever it is, that's based off of millions of people who are like you and have the same debts that you do, and whether or not they pay their bills or not. And so they're basically using all that historical data to say, I think, Jason has a 800 credit score, whatever it is. So that's kind of the legacy way of using that data. But there's some really interesting things that I'll talk about in a few minutes about how you can apply this to insurance behavior and some value that you can extract from your operations based on that. So we'll talk about a little bit about that, the analytics piece. The second category is robotic process automation. And think of this as like macros on steroids, right? So we've had scripting. If you've got an older patient accounting system that's still runs on a terminal emulator, you probably got scripts that run on that and people that maintain those scripts for you. So that kind of concept is not new. Maybe about 10 years or so ago, we saw kind of an explosion in the rev cycle space of web bots. So going out to your payers and getting a claim status and bringing that data back into your patient accounting system. But so the latest generation of technology that's out there are automation platforms that really can do anything a user could do on a PC. They can switch between applications. If you've got clinicals in one system and financials in one and use Excel and email and payer websites, whatever, the technologies that's available today can actually navigate all of those different applications, transfer information between them, do searches, make some logical decisions, really kind of emulate more what human RevCycle employees have been doing all the time. There's a couple of big names that you might have heard of called UiPath, Automation Anywhere, Blue Prism. Those are the platforms, right? So, when you're looking at potential for automation, if you're going to do it yourself, you would look at those platforms. If you're going to use a vendor, you would want to kind of understand, what platform they are using to drive that value for you. Again, we'll talk about some examples in how that applies to RevCycle here in a few minutes. The third group under this kind of banner of artificial intelligence is supervised machine learning. So supervised machine learning is where you use iteration and a subject matter expert to teach the rules over time, right? Every time you see something, categorize it. Do I do this or do I do that? Validate those rules through repetition, right? So you're kind of absorbing that knowledge. Think about it like a child growing up, through their formative years, from 0 to 18 or maybe beyond. They're always kind of learning new stuff and learning ways to behave and understanding the norms and what they're supposed to do and things like that. The supervised machine learning technologies are able to do that obviously much faster than 18 years, but within a couple months you can actually absorb a lot of the decision processes that people make in a particular case study. So I think this is really the most exciting area for RevCycle, and I'll talk a little bit more about examples of this in a minute. The last category, and I have this on here because I want to talk about, because this is what people think of when they think of artificial intelligence, and that's unsupervised machine learning. That's basically you throw a black box on something and it just figures it out. You don't know how it did it, but it magically figures out what it's supposed to do. And there are some, amazing technologies outside of healthcare and RevCycle that have, accomplished some of this unsupervised machine learning. So that's really kind of more like the sci-fi, aspect of artificial intelligence. But I don't really think it's ever going to apply to RevCycle. And the reason is we are highly regulated. We have to make sure that our compliance is, above all accurate, right? We can't, sacrifice compliance to get something done. And so the example that I have of this is, if you threw an unsupervised robot at a pile of denied claims, it might try different things and test different stuff. And it might find that it can get that claim paid if it changes the code on the claim, changes a diagnosis code, changes a CPT code. Well, you don't have that governance around it to say, no, you can't do that because it's not compliant, right? That wasn't in the medical record, or that wasn't, appropriate. But it could go off and start doing all this stuff, and yeah, you'd get your claim paid, but you'd be opening this huge, risk for compliance issues and stuff. So I have this on the list because this is what people think about when you say artificial intelligence, but I don't think it's really ever going to apply to RevCycle. It doesn't mean that other stuff isn't valuable, but again, it's kind of where do you focus if you're out looking for solutions. Don't get distracted by the shiny objects. It's what show me the practical real world examples and how it's going to actually deliver value to me as a RevCycle leader. So those are really kind of the four kind of technical components, I guess, or buckets, I would say, under artificial intelligence. I just have, a comment on here that obviously, because of our level of compliance, HIPAA and everything else, we have to have a foundation of trust and transparency. So if you're going to employ automation in your RevCycle, there has to be clear documentation. You have to have an audit trail. You have to know exactly what that automation is doing so that you trust it. If something ever happens, you come back, you get exactly at the step-by-step process, and figure out okay, it did everything the right way that we told it to do, and here's our documentation. So got to have that level of foundation of trust. Okay, so let's talk about, why you would do this. And, some of this is pretty, common sense, right? So obviously we've got, cost and performance pressures. We've always had that as rev cycle leaders, always being asked to collect more cash, always being told don't hire more staff. Um, and I think, COVID just kind of did basically tied our hands behind our back, right? So we had even fewer resources to try to do this. We still had to keep the cash coming in, still have to keep our hospitals and health systems, cash positive so they can, provide the services to the community and do all of that. So the idea that, we need to automation is nothing new. Obviously, I think the AI technologies that I talked about are pathways to do this. Obviously, it's a collective effort, right? It's not any one magic solution. There's no silver bullet of AI that you're going to go and flip a switch and automatically collect every bill and do it, for super cheap, right? So it's taking all these different pieces, understanding your organization, understanding how they can apply and how you can get the value. And some of these, your organization might not be set up to get the value, right? You might have constraints on IT or something that just makes it unrealistic to get a value back out of that. So you focus on another area of the AI technologies. So there's a lot of flexibility around that. And if this is such a game changer, why haven't we had this before, right? Why have we run rev cycles for the last 20 years without having a lot of this in place? And I think that's for a couple of reasons, right? Because you have an extreme amount of complexity. So the way that people work accounts through work queues, whatever process of rev cycle you're talking about, whether you're talking about pre-service or AR billing, or where you're talking about collections, whatever, there's a lot of complexity, right? And most of this is in people's heads, right? So if you hire a new employee to your business office, there's not a 6-inch binder of instructions that you hand them and say, this is exactly what you do on every account. It's, hey, go sit with Betty and watch what she does for 2 weeks, and then you'll know what you're supposed to do, right? So we have this kind of tribal knowledge, it's in people's heads. We have, obviously some great employees in a rev cycle that really know how to solve problems, but a lot of that's not documented anywhere. A lot of it is just shared knowledge within the organization. So when you talk about automation, you have to be able to extract that knowledge and develop the rules. Like, what are the rules? What are those exceptions? What are the exceptions to the exceptions? Capturing all of that information in order to do this. And I think that's part of the reason why we haven't really seen this yet. And I think it's going to start to explode over the next couple of years, because I think we're finally got some tools that are able to capture that information. The other thing is that the payers are always changing the game on us, right? So they do provider manual updates monthly, some of them. You have dozens of providers. You may have 5 or 10 top ones, but you have a lot of smaller mid-range ones for your organizations. So just trying to keep track of all of those business rules is crazy. I remember this was at Becker's in 2019. I was out listening to a panel, and somebody had said that they were tracking the quantity of rule changes, and it was over 100,000 rule changes in 1 year when you add all of the payers and all of their provider manuals and all of their updates to that. And that's just a huge amount of change to try to keep track of. So again, I think, this is one of those reasons why we really haven't seen it yet, but I think that the tools are evolving to help us get there. Okay, so what are some of the things that you can see today that get you quick return? They're tangible. These are real examples of things that exist today. And so those include coding, autonomous coding, speech analytics, automation of functions, and then some more sophisticated prediction algorithms to help drive your work effort. So I'll talk about each of these. So autonomous clinical coding is kind of the next generation of CAC, right? So CAC came along maybe 10 years or so ago. That was supposed to be hugely transformative to coding. Didn't end up being a game changer. It helped. It accelerated productivity, but it was only like 1 or 2 steps forward. Right? It wasn't an order of magnitude of 10 type change in this. So the tools that we're actually seeing now that are available have the ability to fully process clinical records, right? They use clinical language engines to understand, clinician language, and to, parse out what they're saying in the clinical documentation and match that with procedure codes and diagnosis codes. And all of this is done, in just a few seconds, and it creates this tremendous audit trail, right? So for every claim that it automatically codes, you get like a 3 or 4 page PDF of exactly where in the medical record, what it picked out, how it mapped that to a specific code, why that code applies to where it linked, and all that kind of stuff. And obviously, this can hugely reduce your coding time. Now, the way that technologies like this work is, they're going to be able to automate the easier stuff first, and that's not necessarily a bad thing, right? You want to reduce the volume. If you've got coders that are doing ED claims and they're doing hundreds of ED claims a day, if you can get 60 or 70% of those to automate, you can take those coders and put them on more complex processes, the level 5 ED, whatever the exceptions are, or if there are claims that couldn't be automatically coded, right? Because there's always going to be exceptions, unclear documentation or conflicts in the documentation that still need that human review. But you're taking that kind of easy work, that repetitive work, off of the plate of those coders, and freeing them up to repurpose them onto something else. So that's a technology that's available today. Another area is voice analytics, and this is really kind of the idea of doing a full real-time QA on every phone call in the organization. Now, I realize that some of you might outsource your patient contact, which is fine. I would say, ask your vendor. Are they doing, call, analytics, voice analytics on their calls? Hopefully they're recording all their calls, but ideally they're going to have some technology that does this assessment. And this can create, it can listen for like keywords. If you have some compliance, make sure you do your HIPAA verification. When you talk to the patient, you can listen for that. You can also listen to tone of voice. Are people getting escalated on the calls? You can trigger that to go to a supervisor to tap into that phone call in real time, or you can save that and archive that for follow-up with that agent, and coaching and training afterwards. But you're really getting to the point of using that technology just to help ensure your patient satisfaction, right? So yes, patients will get upset with bills and services and things that have happened. But whether you're doing your patient collections yourself or whether you have a vendor doing it, you want to ensure that you're doing everything you can to de-escalate that, solve the issue for the patient, make them happy, and again, create that positive patient satisfaction score if you're feeding into your HCAHPS scores, to make sure that patients who go through the process are happy with the health system. So that's a tool that's out there. Again, this is something that uses kind of that AI-ish technology to go through and understand language and translations and tones of voice and stuff like that. So some great technology, a good value to the organization from a patient satisfaction perspective. Okay, so let's talk through a couple of examples that are a little bit more sophisticated. And these are really taking robotic process automation and supervised machine learning and marrying them together in order to automate high volume processes. So there's a couple that I'll use as examples. One of those is pre-auths. So this is a huge burden on every health system. And actually, there's really kind of two sides to the pre-auth point, right? So if you are managing a team of primary care physicians that are referring out, you have the responsibility, or your employees downstream have the responsibility of creating that authorization for that, CAT scan or for the sleep test or whatever it is that you're needing authorized, and going through the payers portals. There's, like AIM and Evercore, whatever, that have specific questions that have to be answered. You have to provide them the clinical information to support the authorization request. You have to put all the data in correctly. Again, it's just very busy work, right? It's very repetitive, especially if you're doing a lot of these over and over again. So that's one aspect of auth. The other is on the servicing provider side, right? So if you're a health system and you have radiology centers, right? So you're taking the input of these authorizations and you have to validate. Did they auth the right CPT? Did they put the right address for the service on it? Did they is the NPI right? Is the coding right? Obviously. And again, it's very repetitive, right? Because if you don't check every single one of those, if 1 out of 10 auth was done incorrectly by the referring provider and you still render that service, you're gonna have a 10% denial rate, right? Because the payers are gonna say, oh, no, wrong code or wrong location, whatever, you didn't have an auth denied. So you have to check every single one of those. And 9 out of 10 might be fine, but the 1 out of 10 that you find that isn't, you have to check them all in order to find that. And that's a great example of how robotic process automation can take you through that process, because it could, doesn't matter even if you get to 99 out of 100 are right. If it's a bot that's going through and checking that, who cares, right? It can check 1,000 of them. It's not burning any human time to validate that. But if it finds that one that was done wrong and flags that and sends that to somebody to amend the authorization or reschedule the service, if that's the process, whatever that business process is, there's a huge value for denial prevention by automating this authorization space, whether it's on the requesting or the receiving side of authorizations. The other big area I think is starting to deal with what is the action required to solve an unpaid claim in your AR. So we've had claim statuses and we get 835s and 277s, and some of us might have vendors like Recondo that have got web bots that are bringing us data back, right? It was all this data is coming back into your patient accounting system, sometimes as notes, maybe sometimes as workflows, depends on kind of what your organization has done. But a lot of what happens is, those tend to go back into a work queue, and your collector, your follow-up person, your biller, whoever's working your queues, they need to look at all that information and they need to say, what do I need to do to fix this? So, a great example of this is the dreaded CO16 denial code, right? More information needed to process your claim. Like, well, what do you need? What exactly do you need? Do you need medical records? Did you not like the coding? Did you think there was something wrong with how the coding was presented on the claim? There's all sorts of different, nuances to what could go into a CO16 denial, right? So you have to be able to dissect that a little bit, whether you're looking down into remark information, whether you're just learning from payer behavior, right? So if it's Blue Cross and they deny this particular denial code, I know even though the denial code says one thing, what they really need is a medical record or op report or whatever it is that they need. You can actually kind of teach the systems to find the right piece of information, regardless of kind of what coding that they're using or how they're using the standard coding in the industry. So this is a great opportunity where, right, so the supervised machine learning can look at what people are doing, what actions people are taking to resolve those denials, and start to learn and build business rules around that. And the more you iterate through those processes, the more the system will say, hey, I think this is the rule that we should follow, or I think this is the action that we should take. And again, it's the goal here is to get to the point where some material percentage of your rejected claims get fixed automatically, right? The complex stuff, the inpatient complex, stuff, multi-payer, weird contract, all kinds of stuff. You're always going to need your subject matter experts in order to solve that kind of critical thinking stuff. But the basic stuff, was a radiology appointment, denied for requesting the radiology report. right? So that you should be able to create an automation that sees that denial or request from payer, goes into the clinical system, grabs the correct documentation, gets that over to the payer, whether that's uploading through the payer's portal or e-faxing or whatever it is that the payer needs in order to get that information, and then marking that forward in the work queue and saying it's been resolved, right? So getting that information flow going forward. And again, like I was talking about with the autonomous coding, this is going to solve the easier ones first, right? The easier fixes first. But again, that's just busy work for your staff. You're paying a premium to skilled employees who understand RevCycle to just push buttons sometimes, right? So yes, they're going to work on creating sophisticated appeals when it's required, but the more of the busy work you take off their plate, the better aggregate productivity you're going to have, because you're going to have the productivity from the automation, and then your employees are going to be able to do more and more appeals or solve more and more complex denials and issues that are going on in your AR. So a lot of interesting opportunity around this. We're seeing solutions already that can do this automated, generating an automated appeal, technical reconsideration appeal, uploading medical records automatically to payers, things like that. So a lot of this stuff already exists. It's just kind of coming to fruition in the last year or so in the industry. So definitely something that you should look into if you're not doing anything like this. The last set of examples I'll have, and I mentioned this before, is talking about those prediction tools. So we've had propensity to pay for a long time. Some of us use presumptive charity scoring as well, so that those are kind of existing examples. But the really interesting space here is talking about payer behavior, right? So could you look at your past denial data and build a model that says, what's the probability this claim is going to get denied when I release it? And if it's over a certain threshold, if it's a 70% chance that this claim is going to get denied, maybe you put a bill hold on it. Maybe you look at it before it goes out the door and say, is there something, it passed all my edits, right? So it didn't hit a normal bill hold, but for some reason the payer just doesn't like this type of claim. What is it? What is it about it? Are they going to deny for accident information? Is there a form that we collected when the patient was in the ED that signed and says I have no accident that we could attach with the claim to preempt that denial? I don't know. So again, that's part of the learning process. But from the probability and prediction, you can do some really interesting things with understanding the payer behavior. You can predict how many days it will take them to process a claim. If you think about kind of legacy RevCycle follow-up, old school follow-up, every 14 days, we're going to call the insurance company and say, what's going on with our claim? Well, if you looked at your data and you saw that, United Healthcare pays their outpatient claims on day 18, like clockwork. 18 days after that claim gets transmitted, I got a remit in the door. Well, you wouldn't want to follow up on those claims on day 14, because they're all going to say, it's in process, it's pending payment, or here's a check number, whatever, right? So you've kind of burned that collector time to say, I'm going to go get some information and say, is this claim in process? It doesn't really add any value to the organization. But if you were able to control your work queues so that those claims get followed up on day 19, then 80 or 90% of those claims should have been paid. And yeah, you have a few denials to deal with, but the ones that didn't, those are the exceptions. Oh, I got sent to the wrong payer, or, something didn't get into the system, right? So, but again, I'm focusing my employee resources on problem solving and value add solutions, like they're going to fix something and get something paid, versus just checking a claim status to say something's in process. So again, you can use the probability tools for that. And the other, application would be to look at your HDR. And this one is, admittedly a little uncomfortable for some of us RevCycle leaders. But if you could look at your AR over 360 and run a model on it and have the model tell you which accounts have a 0 chance of ever getting paid, just write them off. Don't bother keeping them in the work queue. Don't bother outsourcing them to a vendor. It's just like, you're just kind of kicking the can down the road. If you're not going to get paid, write it off. So again, that takes a level of faith within the algorithms to make sure that you're not going to write something off incorrectly, but it's a possibility, right? So you can totally use this data to understand which claims are going to get paid. Maybe you don't write anything off, but at a minimum, what you could do is you could rank order everything, put it in the order of most likely to be paid to least likely to be paid. And then, when you're working those through, your staff are working those through, they're going to spend their time on the ones that are the most likely to get a payment in. And if they run out of time, or if they can't get through the work queue, or if you're down on resources or productivity because of COVID, the things that aren't getting worked are the ones that are least likely to be paid. So you're minimizing that risk, maximizing the return back to the organization. So some great opportunities to use prediction tools for areas of the rev cycle that you might not have thought of before. So some interesting opportunities. Okay, so wanted to make sure you guys have some good takeaways from this presentation, and one of those things is giving you some ideas of what to ask a business partner. So if you're just in that percentage of folks that are still kind of exploring it, you haven't started yet, or you're just starting to contact vendors, what are the things that you should ask those partners? Does the company specialize in revenue cycle? So this seems obvious, but we are seeing a few vendors try to enter the rev cycle space that don't have any experience in rev cycle. They're maybe super smart brains, with some amazing AI skills and backgrounds, but they don't understand the business, right? So that could create a long lead time in order to realize some value, right? Because if you bring in somebody, to look at your AR for automation, and they say, well, what's a denial, or why is the insurance not paying this? It's like, I don't understand. We know that business, rev cycle leaders, we all understand this is the game, right? That gets played between providers and payers, and trying to create that balance of getting clean claims through and getting payments in. But for somebody who doesn't understand the industry, it's going to be a long learning curve for them to understand, why things get denied, how you prevent the denials, what different aspects of the business, and why things are the way they are, in order to build that into the automation. So specialization in revenue cycle, I think, is important. Kind of a related question is, are they a broader RCM company? And the reason, not that you're necessarily going to buy additional services from them, but that the company has the resources and the knowledge base to kind of ask themselves questions, right? So if they have, if you're trying to do some automation for a regional Blue Cross, and the company itself might have had experience like working with that Blue Cross with some other client, right? And understanding some of the nuances or the quirks with that particular payer, or the special rules that they have, and feeding that information. And again, the more knowledge that you put into your solution provider, the better off you'll be. So, look at maybe somebody who has got some other kind of supplemental services, just to make sure that they've got that base of knowledge in the organization that they can tap into. I would say make sure that you can get a customized solution. Everybody has different workflows. If you're on Epic, you're on your version of Epic, right? So maybe the screens look the same, but the workflows are all different, the code's different, everything's different, right? So you have to make sure that solution that you're looking at can be customized for your processes. There are things that your health system wants done a certain way, or your payers require you to do something a certain way. And so you have to be able to have that flexibility to accommodate that variation. It's not a one size fits all solution. And then the last thing I would say is get references, right? So have they actually deployed technology And can you see examples of that, or at least get a positive reference from somebody who's got automation running and says, wow, this is amazing what these guys are doing. You got to work with them, right? One of the tricky things I've kind of realized with the experience is, we're talking about automating live patient accounts. And so it's difficult to do a video, right? Because it's PHI. So you have to blur, half the screen and kind of talk, about what's going on in the background, but, if you get that reference, right? So you may not actually be able to watch automation working for another health system, but you can talk to a peer, a rev cycle leader, a, manager of operation, whatever AR of patient access, whatever that particular business unit is that's using that technology, and they can tell you, this is what it's doing for me. This is the value that I'm getting back from this. So again, look for somebody who's not using you as their partner to build a new product that's never existed before. Look for somebody who's actually got products up and running that has positive references that you can take. So those are kind of the key questions. Just to circle back on MediWit, we do offer these. I'm going to skip through these slides. We can share this. I think you could probably get a download after this anyways. So all of the things that we've talked about in terms of automation, these are the things that whether you're looking at MediWit as a potential vendor or any other company, these are kind of the things that you would want to look at. Capabilities, making sure that the information is feeding back into your patient accounting system in a patient-friendly way. And again, it's about eliminating those high volume, low complexity work efforts that just tie up staff and keep you guys from achieving those great AR days and the record cash months. So the last piece that I wanted to circle back on is just the idea that robots are going to take people's jobs. If you're talking to staff level people, that's a very real fear. That people are going to lose their jobs over this. And, it's not really the purpose and not really the intent of this is to eliminate jobs. The RPA industry has a term that they call upskilling. So basically, you're going to take the busy, had somebody tell me this was the soulless work of rev cycle, like the repetitive over and over, got to fix the same thing over and over again. You're taking that off people's plate. So you're going to make them happier by not having to do the drudge work. And you're going to refocus them. So you're going to reinvest in those subject matter experts. You're always going to need those people who really understand how to solve those problems. And you're actually elevating their value or their skills in your organization. Over time, maybe you have to backfill fewer people, so maybe there is some long-term, effect on the size of the business office. But again, this is not a tool that is intended to come in and riff 50% of your workforce. This is really intended to elevate the sophistication and the skill level of the people in the organization. You're always going to need those experts, even if they shift from I'm the expert who's working at claims to I'm the expert who's teaching the automation how to do the work, right? So you're going to need those rev cycle people, and you can reinvest in them and hopefully reassure them that any technology you bring in is not really about job elimination. It's about efficiency, health of the organization, stability of the health system, insulating from future disasters. If we have COVID 2.0 that shuts us down again, making sure the businesses can keep running. So that's really what I wanted to leave everybody with, which is just kind of framing that these technologies are very complementary to how we run the business, and it's our responsibility to really ensure that the employees, if we do bring in these technologies, the employees understand why we're doing this and the value that it's going to bring to the organization. All right, so that is it for the presentation. We got about 5 minutes or so left in your lunch hour. If there are any questions, I'd be happy to answer those.
Jason, it doesn't look like we have any questions at this point, but they do have your contact information. If you guys have any questions, please reach out to Jason. So thank you for your time today. One last reminder to submit the survey that you will receive from CVent in order to get your CPE certificate. And with that, that concludes our webinar. Thank you, everybody.